there, this is Janice Miner of Reset and Restore. Welcome to my channel. Here at Reset and Restore, we are a brief, audible eye-opener just to remind you to steward your entire being. That's your spirit, your mind, and your body. And today we're going to talk a little bit about chronic pain, but before we do that, I want to thank you for joining me here. And if you have not subscribed, do me a favor and hit that subscribe button up there. Not only hit the subscribe button, but ring that notification bell because you don't want to miss out on any of the things that we share here on Reset and Restore. Like I said, it is to put into balance your entire being so that your body can experience optimal health. Invite a friend to come over next time. We're here every week, and when you hit the notification bell, you'll be reminded of when I am on. So with that being said, let's jump in and talk a little bit about inflammation. Well, not inflammation, about pain, chronic pain. 25% of people with chronic pain go on to develop a condition that's called CPS. And that's when people have pain that goes beyond the normal pain. It's not acute pain that, hurts for a while and then you get over it. It is chronic. It is continual. It's like a throbbing, toothache that never goes away. And it brings with it things like depression and anxiety. It can interfere with your daily life, your daily routine. Things that you did on a normal base now can become very, very challenging. CPS can be hard to treat. With the symptoms, you can feel like it's impossible. It's impossible to get the care that you need. It's impossible to explain to your numerous physicians what your body is going through, what this feels like. But CPS, chronic pain, can be caused by a number of things. Conditions that accompany CPS or normal aging that affects the bones and the joints in a way that causes chronic pain. And pain beyond these common causes, they may arise because of an injury that you've had or something that just really won't heal. A traumatic brain syndrome known as TBI, or a combination of them, all of them, both of those, with nerve damage, whether that nerve damage is temporary or permanent. Some kinds of chronic pain, for instance, let's take back pain, may be caused by a single factor or a combination of a lot of factors. And let's just go through a few. You could have chronic back pain because of years of poor posture. You could have, experienced improper lifting or carrying heavy objects, or you may be overweight, and because of the excess strain on your knees, your hips, and your back, it causes chronic pain in your spinal area. You may have a congenital condition such as a curvature, of the spine. You may have developed poor spine alignment for wearing high heel shoes over a long period of time. You could have a traumatic injury. You could have a concussion or concussion syndrome, or you may be sleeping on a very poor mattress, or using pillows that properly or improperly support your cervical spine. You may have neurological causes that present no physical cause. Ordinary aging, that's always in there, or degenerative changes in your spine, and that can be from at any age and could be caused by many different factors. Your body being deprived of the right supplements and nutrients that it needs could also prematurely cause a degeneration in your bone structure or in your spine or in your muscle tissue that will cause you to have chronic pain. Well, disease can also be an underlining cause of chronic pain. Diseases like rheumatoid arthritis or osteoarthritis or fibromyalgia, other immune disorders. Persistent pain can be due to ailments like cancer and multiple sclerosis or stomach ulcers or diverticulosis, gallbladder disease, and venereal disease. Although it may begin, it may start, from an injury or an illness, ongoing pain can develop a psychological dimension after your physical problem has healed or has been healed. And this fact alone makes pinning down, a single course of treatment very tricky and very complicated. So some of the things to consider when you are trying to pinpoint where you need to start to seek medical advice and for help on getting out of so much pain is to look at what causes your pain. What type of pain is it? Where and what symptoms are you experiencing? And what are you doing that increases or causes this pain? And the location of where the pain is. Have you had a diagnosis by your medical doctor? Have you been prescribed or have you had diagnostic testing done? Are you receiving treatment and care? If you are, is that treatment or care, is that helping at all? Or is there no improvement at all? How, is your living and your lifestyle management? Are you able to get out and continue doing what you normally do, or has it prohibited your social environment or your ability to interact with your family? Is it interfering with your relationship with your husband? Is it interfering with any activity, your sports or things that you normally enjoy doing for relaxation, for meditation, for just for your own mental state of health? Do you have a support system or a resource system which you can utilize or you can turn to? Well, these are just a few of the exploratory questions that I use in my practice by using a functional nutrition matrix tool, and it helps guide my clients to discovering a better self-discovery of where to start getting a baseline for where pain has begun, where it started, if it's because of an injury or if it's because of an illness, a physical illness. So now my question is, hopefully this has been informative to you, and if you want more guidance on pain, on chronic pain, head on over to my webpage. It's www.cuhealthy.com. Contact me or go to the my Facebook page. It's Reset and Restore. And join the conversation. Join the conversation. I would love to hear your comments and ask the questions that you may have. And I look forward to giving you some answers and pointing you hopefully in a direction where you can get some relief, because pain is not fun at all. Pain actually ages us prematurely. Not only does it age us in our physical ability to be involved with life, but it wreaks havoc on our mental ability, which, like I said, we have to have that balance, right? chronic pain can cause you to either become anorexic and lose an extreme amount of weight because you don't feel like eating, or when you do eat, it causes more pain, or you become so sedentary because of this. Now you put on a huge amount of excessive weight, which now leads to other issues that exasperates your pain and cause other medical conditions. So I would love to be a part of that conversation with you. Like I said, head on over to www.cuhealthy.com and comment and leave your questions, and I will get back with you. I'll get back with you. This is Janice Miner, and you're with me here at Reset and Restore. I'm here every week. Hit that notification button, that subscribe button, so you don't miss out on any of the life lessons that I've learned through life experience, going through injury, from being bedridden to being wheelchair bound, to using all kind of walking apparatuses, to losing all of my friends, losing my job, not feeling worthwhile or just worthless in life. So many things happens to you when you cannot be a viable part of your life, your own life. And through these experiences and through trial and error and through so much involvement with Western and Eastern medicine, I feel I have a wealth of knowledge that could inspire you and could point you in the right direction. So until next time, this is Janice Miner, and as I always say, see you healthy. Bye for now.